Hello, and welcome to Stump the Expert Health Insurance. This session is part of the Caregivers and Self-Care track. It is intended for caregivers or individuals living with all forms of DM. The panel will only address topics and questions related to the U.S. healthcare system. International attendees are very welcome, but again, our panel will only address questions and topics related to the U.S. healthcare system. This session is being recorded and will be available for viewing after the conference on the MDF Digital Academy at www.myotonic.org/digital-academy. I am Mike Knoppen, the MDF Program Director, and I am delighted to be with you today, especially privileged to be able to present an extraordinary panel of experts on insurance and healthcare who are going to address some of our most pressing questions. And I'm going to introduce them to you now. To start things off, we have Ryan Frame, a claims specialist. He's been with the Social Security Administration since 2008. He currently serves the public as a claims specialist with the Daly City, California field office, as well as handling sensitive and high priority cases for the San Francisco Regional Public Affairs Office. Welcome, Ryan. Amy Jackson is a patient access specialist. She is a patient access specialist at the Patient Services Incorporated, a national nonprofit charitable organization. Amy is a graduate of Longwood College with a career focused on serving those who've been underserved. Amy has been providing health insurance education for over 14 years and has spent that time educating rare disease populations. Having an understanding of the health insurance challenges these communities face, Amy is passionate about providing the information they need to assist with overcoming or avoiding some of those obstacles. Welcome, Amy. Next, we will have a presentation from Erin Bradshaw, the Chief of Mission Delivery for the Patient Advocate Foundation. Erin provides leadership in the design, delivery, and oversight of the case management division to ensure the achievement of the organization's philosophy, mission, and goals and objectives. Her 23 years experience with PAF has been spent improving patients' lives around the nation. The final member of our panel, who will not be offering a presentation, but will be assisting during the question and answer portion at the end of the presentation, is Nurse Erin Springer. Ms. Springer is a clinical care nurse coordinator in the neuromuscular clinic of the Iowa Neuroscience Institute in the University of Iowa Hospitals and Clinics. She provides numerous services, including case management, coordination, and genetic counseling for adult patients who've been diagnosed with neuromuscular disorders. Now, let's turn things over to our first speaker today, who will be Ryan Frame. Please, throughout the presentation, if you have questions, share them in the chat, and we will address them after our presenters. Take it away, Ryan.
Thank you, Michael. Good afternoon, everybody. I'm really happy to be here with you. Hopefully, I have some good information to share with you that will be useful to you. I wanted to talk to you a little bit about the benefits that Social Security administers. I should say from the outset that Social Security does not administer health insurance directly, although we are involved with enrollment and premium collections from Medicare, as well as having some involvement with Medicaid. So I wanted to just talk to you a little bit about the benefits that we do administer and how that intersects with healthcare. All right, and I think everybody should be able to see my screen here. So someone let me know if there's a problem, but I think that everyone can see my slides. So first of all, there are a couple different programs that Social Security administers, and there does tend to be problems with people confusing these two programs. So I just want to kind of lay out for you guys what the differences are. So there is, excuse me. So there's Social Security, also known as Title II, which is the part of the Social Security Act, which created Social Security benefits. Social Security disability benefits are also known as Ssdi, and those go hand in hand with Medicare health insurance. We also administer something called Supplemental Security Income, also known as Title 16, which goes hand in hand with Medicaid health insurance. Okay, so what's the difference between the two programs? Well, Social Security is considered to be an insurance program, meaning you pay into it when you're working. So payroll taxes and self-employment taxes fund the Social Security trust funds. And then when people hit retirement age or become unable to work, they're entitled to benefits from the Social Security trust funds, as are their children and spouses in some cases. Supplemental security income is not from the Social Security trust fund. Supplemental security income payments are needs-based assistance from the General Treasury Fund. And unlike Social Security, they're not based on past work. These are based on being below certain thresholds of income and resources. So again, those are needs-based benefits or payments. So it can be a little confusing. Ssdi is Social Security disability insurance. SSI is supplemental security income. Some states call their state disability payments SDI. So it's important to understand, what's out there, what the difference is, and what you have or what you're applying for when you're interacting with us and trying to get these benefits or payments. Now, just briefly, as I said, Social Security benefits go hand in hand with Medicare. So if you're entitled to Social Security benefits, whether as a retirement benefit or a disability benefit, then after a certain period, you will become entitled to Medicare as well. That's automatic for Social Security beneficiaries, although you can become entitled to Medicare without being eligible for Social Security in some cases. So most people over 65 are eligible for Medicare. People who have disability benefits through Social Security are eligible for Medicare after 24 months or 2 years of Social Security disability insurance. And then there are also some special categories of folks who become entitled to Medicare quickly, which would be people with kidney failure and stage renal disease, and also people with ALS, also called Lou Gehrig's disease. Medicaid, which, as I said, goes along with supplemental security income payments, is a joint state and federal health insurance program for, again, low income and low resource people. So federal law says that if you're entitled to supplemental security income, you are also eligible for Medicaid. But how that works differs from state to state because it is a joint state and federal program. And so in some states, such as California, where I am, if you apply for and are approved for SSI payments, you will automatically receive Medicaid or Medi-Cal, as we call it here in California. In other states, a separate application is required. And again, you can be eligible for Medicaid without SSI, as well as getting it through entitlement to SSI payments. So how do you get these benefits, or how do you get these payments and become enrolled in these insurance programs? There's 3 ways to file an application with Social Security. Usually you can file in person at your local Social Security office, either with or without an appointment. However, unfortunately, we're not doing that right now because of COVID-19. We have not reopened from our closures, our office closures. They're still working out how to reopen safely, given the volume of people that we assist. But you can apply for benefits over the phone. We can make you a phone appointment for someone to call you at a specific day and time to take an application for these benefits. And you can also file online. So you can see at the bottom of each one of my slides here, www.socialsecurity.gov is our website, and you can file an application there and find contact information for your local office if you prefer to make an appointment by phone, or hopefully in the near future in person. Now I'm going to focus on disability benefits today, but just know that all of both Social Security and supplemental security income can be age-based or disability-based. So if you're, whether you apply online, over the phone, in person, if you apply for disability benefits, the basic process goes, we take your application and ask you to provide certain documents to verify the factors of entitlement for the benefit for which you've applied. We review your application and make sure that you meet the basic requirements. So that's everything aside from the disability, the medical condition, which may be your age, your citizenship, your work history, your income and resources, depending on what you're applying for. And then we send your case to a state agency, which is called Disability Determination Services. Each state has one of those, and they have to make a medical determination on both Social Security and SSI disability cases for us to officially consider you to be disabled for our purposes and start the benefits or the payments for you. You know, you'll note that there are multiple requirements for the different programs, and they are all based on proof, documentation. So it's important when you're applying for benefits with us that you read our letters, that you listen to the employees that you talk to, and unfortunately, we can't take things for granted. So keep in mind, we're required by law to request certain things to prove the factors of entitlement for the benefits. And we can assist you in getting those things, but be prepared to be asked for proof of various factors of entitlement for these programs when you apply for benefits. Now, I just did want to quickly mention that there is something called compassionate allowances for our disability benefits, which for certain conditions allow us to make a very quick disability decision with minimal evidence. There are 228 conditions, I believe, currently that qualify for this, congenital myotonic dystrophy being one of those conditions, although you can be approved for many, many different conditions, even if it's not on the compassionate allowance list. I also wanted to just note that I understand that a lot of people out there, and I talk to a lot of people every day, find it daunting to talk to Social Security to apply for benefits, have difficulty for various reasons. And, you know, it's important to advocate for yourself when dealing with Social Security, because unless we talk to you, we don't know you're out there and potentially eligible for benefits. In most cases, we don't get any leads on potential eligibility for members of the public until they come and talk to us. And particularly dealing with folks with various disabling medical conditions, you know, that can be hard sometimes. So I wanted to also point out that you do have the right to be represented when you're dealing with Social Security. Sometimes your representative can be an attorney or an advocate, but it can also be a family member or a friend, someone from a community organization, a religious group that you belong to. And if we do the paperwork, if you've signed something to officially appoint someone to be your representative, they can talk to us and take actions on your behalf. So if there's someone in your community and your family who's having difficulty pursuing benefits with Social Security, consider, you know, offering to do that for them, because it can be very helpful with our process sometimes. So that's a basic overview of our benefits. Again, our website is socialsecurity.gov. Please make sure when you visit us that you're at .gov, like government. There are other websites out there, if you just Google Social Security, that will try to charge you for forms and publications that are free, or even collect your information for more sinister purposes. So again, socialsecurity.gov, like government, is our website. And I just wanted to note that we offer information in a variety of languages. And we can also offer on-the-spot interpreter services whenever you call us or visit one of our offices. So don't let limited English proficiency be a barrier to talking to us. If you know someone who's hesitant to talk to us or to call because they don't speak English or don't speak English very well, let them know we can offer services in a number of languages, including interpreter services for on the spot for phone calls. And then Medicare also has an entirely separate website if you want some more information about Medicare health insurance, and that's Medicare, again, .gov, medicare.gov. So that's a basic overview. I look forward to hearing your questions and being able to help out a little more. But I believe now it's time for us to hear from Amy. So thank you very much for your time today, everybody.
Thank you so much, Ryan. I appreciate that. So I'm so honored to be here with all of you today. All right, thank you so much. So again, I'm so honored to be a part of such an amazing community. I have a brief presentation for you today, as I know that the focus will be on your questions for us. So my presentation is titled Health Insurance, a Brief Look. And as Mike introduced, I am Amy, and I'm a patient access specialist at PSI. I'm extremely passionate about health insurance education, especially with the rare and chronic disease communities. I could probably sum up that passion with the quote you see here: health insurance education is important because sometimes we must be the insurer in insurance. So ensuring our coverage works for us, right? So my objectives today are to review some common health insurance types. I won't be reviewing them all, but just some common ones with some DM notes along the way. So some highlights for the DM community I wanted to mention. And I have a health insurance do and a don't. And since health insurance is so complex, it would be impossible to talk about any one health insurance topic in just a few minutes. A wonderful resource to help you learn more about everything I'll be talking about today. So let's get started. So the first health insurance type I'm going to review is Medicare, which Ryan has already told you a little bit about. So it is a public health insurance program. The eligibility groups are those 65 and older, individuals who've been declared disabled, or the Ssdi that Ryan mentioned, individuals with end-stage renal disease or Lou Gehrig's disease. Again, Ryan mentioned those, so this is good too that I'm reviewing that. Medicare, as was shown on the slides with Ryan, Medicare Part A is hospital coverage and Part B is medical. Individually or collectively, they are known as Original Medicare. Medicare beneficiaries can add drug coverage, which is Part D, or they can get a Part C plan, which often combines A, B, and D. And also they have the option of a Medicare supplement, which is also alphabetized. So it can get very confusing. So I encourage you to visit the website that Ryan shared, medicare.gov, to learn more. I did want to highlight some points for the DM community that I thought were important to mention. Again, Ryan did also mention this in his presentation, but if you are approved for disability Ssdi benefits, it will start on the 25th month after you've been collecting the benefits. Medicare Part A is free if you have 10 years of work credit. So that was also mentioned, but you can qualify possibly based on a spouse or parent. Medicare, Original Medicare does not generally cover genetic testing, but some Medicare Advantage plans, which is the Part C, may cover genetic testing with limitations. Part C plans are managed care, which I will be discussing a little bit more in just a few minutes. The next health insurance type I want to review is Medicaid. Again, that's a public health insurance program for low-income children, pregnant women, some adults, the elderly, and disabled. As it was mentioned, Medicaid is different in every state, and there are currently 12 states that have not expanded Medicaid. And really what that means is that for the states that have expanded Medicaid, adults can qualify based on income alone. And for the states that have not, they have to meet one of those other categories in addition to being low income. And there's also the Children's Health Insurance Program called CHIP and available in every state. Some highlights for the DM community. Again, most Medicaid plans are managed care or often managed care, which again, I'll talk more about in a few minutes. The eligibility criteria is not the same in every state, and that's so important because you might be living in a state where you're not eligible, and if you move, you may be eligible in that state or vice versa. So it's always important to check, especially if you meet that low income category. Some Medicaid plans may cover genetic testing with limitations. Some state Medicaid programs do offer adult dental and vision, but Medicaid programs are not required to. You can have Medicaid with other insurance, but just always remember Medicaid is the payer of last resort. The next health insurance type we're going to review is group coverage. So group is health insurance that's offered by an employer or employee organization. It can include medical, dental, and vision benefits. Not all employers offer health insurance, but most do. And then COBRA is a federal law that allows you to continue the group coverage. So if you lose group coverage, in most instances, COBRA may be available for you to continue that group coverage for a limited time. Some highlights on group coverage that I wanted to bring up for the DM community are also group plans use managed care. You can stay on a parent's plan until you're age 26. So that's true even if you're married, you can still stay on your parent's plan until the age of 26. COBRA may be an available option, as I mentioned, if you lose the coverage. And I indicated that COBRA is a federal law, but some states have additional COBRA laws. So it's important to do your research. A loss of group coverage also generally creates what's known as a SEP or a special enrollment period to get other coverage. So it's important that you review your options if you lose group coverage to determine which route or which option is best for you. It is important to note that both COBRA and SEPs have time limits to enroll. So if you lose that group coverage, you want to make sure that you're reviewing your options immediately to avoid those time limits. And the last health insurance I wanted to review is individual coverage. So this is health insurance sold by private insurance companies to individuals and their families. Not all individual plans follow the ACA, which is the Affordable Care Act, but plans that do follow the ACA can be sold through a marketplace or directly to consumers. The private insurance company can sell them directly to you, or you can get them through the marketplace. However, if you get that plan through the marketplace, you can apply for savings. And again, not all plans follow the individual plans sold by private insurance companies follow the ACA. So it's important that you also research a plan if you're buying it directly from the insurance company. And in my highlights for the DM community, you'll understand why. So individual plans are also managed care, which we'll go over on the next slide. The Affordable Care Act plans can't deny or charge you more for pre-existing conditions, but those plans that don't follow the ACA can. So that's important to review. Some individual plans may cover genetic testing with limitations. You can only purchase the ACA individual plans during an open enrollment or during a SEP, special enrollment period. And just remember, marketplace savings, if you choose to get an individual plan through the marketplace and apply for those savings, it can reduce your premiums and your out-of-pocket costs if eligible. So on to a health insurance do and a don't. So do your research. And that's so important. And as I've mentioned through the presentation, your needs and managed care. So managed care is a healthcare delivery system that manages costs by using provider networks and drug formularies. So here are some examples of managed care. So you may have seen these terms: HMO, PPO, POS, EPO. So all of those are examples of managed care. And researching regarding managed care is so important, because when you're looking for coverage, you want to make sure your private providers, facilities, and pharmacies are in network, that your medications are on the formulary. What are your plan's restrictions? Do you need a prior authorization for certain things? And that's when you're looking for insurance. But even once you get the insurance, you're going to be, you're going to have new doctors, you're going to be sent to new facilities. So those things are even important after you get the coverage. So if you have a doctor, he's in network and he sends you to another doctor or another facility to get these tests or another specialist, you want to make sure before you go that they're in network. So, so all of that research is still applicable once you get the coverage. So I can't express enough about doing your research. And my health insurance don't forget your rights. And this is also really important. Don't forget your right to file an appeal. If you have a claim service or medication denied, you and your provider felt it was necessary, utilize your rights to appeal that denial. You also have the right to change coverage. Most insurance types have an annual open enrollment period with other options available. And if there's another option available, it's important for you to do your research to make sure that there isn't another plan available that might work better for you. And your right to file a complaint. So if you have an issue with the insurance company itself, you can file a complaint. The State Department of Health Insurance has a managed care ombudsman available, and Medicare has a Medicare ombudsman available by contacting Medicare. So that's also really important. And so this is a high-level overview of health insurance. Health insurance, as I mentioned, is extremely complex. And all of the things I've talked to you about today are just touching on those topics. So the wonderful resource I mentioned is MDF's Health Insurance Toolkit. So you can learn all about everything that I've mentioned in this presentation. It has some amazing information and has letter samples and just a lot of good stuff that will help you navigate health insurance. You can access MDF's Health Insurance Toolkit from the conference website by navigating to resources, downloadable resources. You can also access MDF's Toolkit, Health Insurance Toolkit on their website. So thank you. I look forward to your questions and I will turn it over to Erin.
Well, thank you so much for, allowing me to present today and share with you some case examples and case studies, and specifically around Patient Advocate Foundation. You've heard a lot of important information from Ryan and from Amy about disability and health insurance. And, our role at Patient Advocate Foundation is really to also support you and help you navigate some of the barriers that you might be facing when you are up against maybe an application for disability or health insurance support need and financial support. So throughout my presentation, what I have planned to do is to share with you several different examples. So Patient Advocate Foundation is an organization that provides case management support to patients, regardless of their health condition, that are running up against insurance barriers, access to care, the financial challenges that might be preventing them from accessing necessary care, as well as helping them learn of social programs and disability opportunities and other ways in which resources can come in to support while you're undergoing treatment or unable to work. So in this particular case study, we have a patient who had came to us, was 30 years old, was insured, was diagnosed with a late stage health condition, and needed some help accessing a second opinion. They also had a disability application that had been pending, and with their disease had progressed to the point where they were needing some assistance with an expedited review. So what we did is the person called in through their wife, and we were able to do a comprehensive needs assessment. And after a full conversation and understanding what was transpiring, we had learned that after 10 months of treatment, the patient's health had declined significantly to enough where they were no longer able to work, and they were finding themselves in a situation where they needed financial support and also access to a second opinion through a medical facility that ultimately was not covered by their insurance company. So this is a very common situation where individuals come to us with maybe more than one issue, and then we're trying to kind of uncover and figure out how we can support them. Well, what we discovered was that their disability application had been submitted and was also pending. And as mentioned earlier by Ryan, there's a lot of, once an application is submitted, if there are changes in your scenario, it is important that you actually talk about that and you bring it up to your reviewer so that they're aware of that information, because they're only relevant to what they've been able to obtain and what they now review. So as we discussed that, we learned that due to the nature of their disease and the advancement of that, they did fall within what would be an expedited review. And we were able to coordinate a second appointment with their case reviewer. And the wife was able to provide that health documentation that ultimately was able to do that approval, and they were able to get access to Social Security benefits sooner. Oops, sorry, I'm clicking. In addition, what we found was that with the second opinion needed, that the person was rolling actually into a COBRA benefit. So because of that, that offered an opportunity for us to evaluate different plan options. And we found a plan that was available to them that had a wider network. So kind of what Amy talked about earlier is the importance of like, where is it that you're hoping to go? And then that gave them the benefit coverage and also the opportunity to schedule that appointment. And he was able to go there and where he felt comfortable getting that information and get treatment. We uncovered that there were some needs around financial solutions. And so we were able to find a grant that also helped them for transportation that they needed. In this case example, this patient was prescribed a medication that she needed, but unfortunately the insurance came back saying it was not medically necessary. This is a very common utilized term for when they can't justify or validate that the treatment that aligns with the treatment that you need based on their plan design and several other reasons that could play in. So she also had a plan provision within it that her diagnosis required retesting before they could consider the treatment at all. So when she called us, we discussed timelines and strategies for expediting this appeal process. We learned the situation and what was causing delay. We conducted some research and found some support to include in an appeal and helped with some collaboration between the patient and getting a letter of medical necessity from the provider and helped draft an appeal that was submitted on behalf. But while we were waiting for that, because we were concerned about her needing to get access to care, we did evaluate clinical trials and other solutions that could potentially help them. We did find a clinical trial and she was connected to the coordinator to discuss a possibility of being included in that. But during that exercise, we were able to actually get the denial overturned and the coverage was approved. Once that was done, she did tell us that there was a real concern out of those out-of-pocket costs that she was responsible for. So we did explore which financial resources were out there that could help accommodate those expenses. And we were able to identify one to alleviate some of those challenges. So not only was she able to get access to providers care, but then the financial concerns that she had was also alleviated, which often people may not go with getting the treatment they need because of that barrier. In this example, we have a patient who contacted us because they couldn't afford their treatment at all. And they were running up against the daily cost of living challenges that they have. She was 40 years old, she was insured, she had multiple health conditions, as you see here, and she had lots of medications and the co-payments were just unobtainable. She also needed some help with some of her unpaid medical bills and needed some help with utility and transportation. And she was permanently disabled, of limited income, and completely dependent on a supplemental nutrition. She fell behind on her light bill and her medical bills, which is very common when people are taking their limited income and trying to figure out how to meet expenses around their medical cost and things that require upfront payment like a medication. So we investigated further, revealed some assistance that was available to her based on her income and eligibility guidelines, and worked with her to facilitate an application for some copay assistance. We dug further and she was a Medicare recipient based on disability. And we did an analysis of her income and found out that she actually qualified for extra help and Medicare savings programs. So we helped her apply for those and confirmed approval on both applications, which lifted and released some of those financial obligations that she had under the coverage that she had there. And then we also connected her with some direct assistance programs that would help with that, the lateness of her utility, but also found a rental assistance program to help her as she progressed through her disease. In this case example, this 20-year-old patient was diagnosed with cancer and she was having a very difficult time finding a network physician. She had a very narrowed insurance plan, and whenever she was trying to find someone to treat her, she was getting no responses and had a significant delay in care, which was very concerning. So she contacted Patient Advocate Foundation, and we conducted some research about her particular plan network and did some research, and as well as placing some calls to multiple hospitals in her area that were aligned within her plan in an effort to identify one that would treat her. So we were able to identify one available network person, and we could coordinate that for her to go ahead and make that appointment. But what we also talked about was the options of getting a wider network and evaluating the coverage that she had during open enrollment, because again, this is an example of a plan design that wasn't working for her support needs and what she was hoping to gain. But the good news is that she did get the treatment that she needed. We were able to uncover some financial support that she needed some assistance with as well. And then she was knowledgeable and educated on what her options were when open enrollment came. And this is Zane. So Zane is a child that was adopted from the Fowler family. And they ran into a bunch of scenarios with an out-of-network specialist, and then the delayed access and a huge financial impact. I pointed on the slide itself, you can actually go to a video. There's a link below the picture if you're interested in watching their family story. But ultimately, at the end of the day, we help them go through the appeal process of gaining access to this very defined specialty that the patient needed. He had a condition that he needed to have a procedure done to connect, his esophagus to his stomach. And so he was solely dependent on new liquid nutritional support. And so now today, because we were able to overturn that denial and get in-network coverage, in addition to the hospital accepting the in-network rate and giving them charitable towards those out-of-pocket costs, he's able to live a productive, healthy life at this point, and then the family is not financially devastated by it all. So that's the type of work that we do for you. And if that's something that you run into, we really just want you to know, not only is Patient Advocate Foundation here, but as Amy was sharing before, they offer a very similar support services to you. So quickly, I'm just going to share with you, these are just the areas that we focus on. I talked about a few examples, and they had a breadth of different focuses and support needs. We are a very comprehensive organization, and we look at the situation from whether it's a financial burden that you're facing regarding basic cost of living, like housing and utility or transportation, to looking at forgiveness and loan support around mortgages or car loans, and just all of the important elements of evaluating your employment status and the provisions of what you're available to you. And then really diving into the depths of enrollment into appropriate insurance or charitable programs or social programs or insurance, really what is important or needed at the time. And then, of course, if you run into an insurance navigation burden, whether that's a coding and billing issue, out of network, second opinion, et cetera, we can help you navigate through that and look at the best steps to take to help you uncover those things. So I just wanted to close with just how you can get in contact with us, and if you should need some support like that. And I really look forward to answering some of the questions that you might have after this presentation. Thank you so much.
Thank you so much, Erin, Amy, and Ryan. I'd like to invite our panelists to unmute themselves and share their videos as they feel comfortable. Also joining us during the Q&A again, in addition to Ryan, Amy, and Erin, will be Erin Springer, our nurse from the University of Iowa. We already have a number of questions for our panel. I'd like to first ask Erin Springer if she could talk a little bit about the implications of insurance in genetic testing, which, as we all know in the DM community, is the first step for most families in the process of diagnosis. So if you could unmute and tell us a little bit about what we know or don't know about insurance coverage for genetic testing or any part of that process.
Sure. Hi, guys. Yeah, my name is Erin. I am a nurse clinician that's worked for about a decade with the muscular dystrophy population at the University of Iowa. And yeah, specifically about genetic testing and insurance coverage. What we are finding in the medical world is that there are a lot of shifting and changing kind of coverage for genetic testing. As more and more testing becomes available, prices are dropping actually a little bit, depending on what type of testing they're doing, because there's lots of different ways to run these tests, or if they're doing it in-house versus having a send-out lab. Prices can vary quite a bit. The thing that I will probably recommend the most is to get ask for a referral to a genetic counselor. Their primary goal for their job is to provide you with the information not only about the disease and about what that means for family or any questions you have, but they also are the ones that are going to go out and search for what testing is available out there, not just through maybe that university's lab. What's going to be, covered by insurance, because there are different labs that cover differently or accept different insurance. What, the lead time takes for those. So some tests take, a couple of weeks, some take months and months, for more extensive testing. The other thing that they do that I think is great is that they are not going to go through and order a whole panel of tests for you. Panel testing is good in some ways, but it can also be dangerous because you may end up with, and I've heard of this, for some of our patients, a $10,000 bill for tests that you maybe didn't need to have. Genetic counselors, their jobs are to look at the symptoms, at the medical history, any testing that has been done, pick out, one or two tests that may be helpful, limit the costs, the out-of-pocket costs for anyone, as well as help to guide physicians on what they should order. Genetic counseling oftentimes is not available other than through major academic centers or places like that. So what I would suggest is you can contact your insurance company to see if they would cover genetic testing and if they would cover specifically a genetic counseling referral. Ultimately, you can push that this is going to save them money by allowing them to narrow down the testing that you may order through and have to, coverage for insurance. So you can push that issue. The other thing that I would say about insurance coverage for genetic testing is that there are more and more programs that are coming out, especially for the muscular dystrophy, myotonic dystrophy communities, where there is low cost or free testing that is available now. The MDA and other organizations are actually helping to cover testing, knowing that sometimes financially, patients and families are not able to cover even, a $200 copayment or anything like that. And knowing that not all insurances cover these tests. More and more labs are coming out with programs to limit the cost to patients. So they'll set a limit to testing and say, your cost won't ever go above $500 or, it varies. The other thing is that going through a genetic counselor or through a genetic program is that if you have a positive test in your family, what they can do is order just specific testing that has a much more price, what do you call it? It's better price wise because you're only ordering specific testing for that gene, knowing that that's the one that's running in your family. And so being able to test specifically for one area is a lot cheaper than testing all of them that could be available. And so making sure you get hooked up with the right providers. And also, I think the different programs that Amy and Erin have kind of introduced have been are wonderful resources. I'm actually learning a lot from their talks and just what kind of different places that can provide these kind of services. Doing your homework, doing your research, and really trying to make sure that you understand the out-of-pocket costs to yourself will be important.
Erin, thank you so much. That's
Yep.
incredibly helpful. I wonder if any of our other panelists would like to speak a little bit about that piece, the genetic testing piece specifically.
Not anything specific, like just knowing that it's really, I know it's really difficult, especially for the DM community. And I've actually been doing research regarding that coverage recently, but it's a lot of programs and assistance out there. So for genetic testing that I've ran across recently. So maybe I could share some of those resources with you, but it is very challenging thing to go through, and especially to get the coverage for it. So you normally have to look for other ways to get those things covered because insurance is so difficult when it comes to covering it.
Amy, thank you so much. Erin B., I think you were going to make some comments too.
Yeah, I was going to very much say what Amy had just shared. And I think it's very specific to the plan that you carry and what coverage that you have, and also your unique needs and your just in general, like your financial solution, your financial situation, and all of that will really play into which programs are available for you and if what you can be eligible for. And as Amy shared before, you really should take advantage of the appeal option. So even if it is something that's immediately rejected, understanding why, and then if you have strong evidence to argue the contractual nature of it, then that should be going down that path. So, but your resources are your genetic counselors and your providers and everyone there to help understand. And they're going to be very candid and tell you too if they know something is traditionally not covered. And I know we're moving down that track of really trying to change, and there's a lot of evolution with coverage and evidence to support things, so that could change tomorrow. So just keep pursuing that and just be aware, because I think an educated consumer of your healthcare is the important part, so that you're not surprised or find yourself in a situation that you didn't expect.
Thank you so much, Erin. Thanks to all of you for your responses on that. One of the topics that's come up several times in the conversation is the term documentation or the term proof. I wonder if we could just go around and I could hear from each of you. I'd like to start with Ryan, talking about what counts as proof. I know Ryan will specifically be speaking about Social Security programs and that process, what counts as proof there. But as we expand on, I'd like to hear what private insurers may, what counts as proof? What should our audience be thinking about as what they can be documenting and what they can be working with their medical team to document?
Okay, yeah, sure. So from a Social Security perspective, well, there's a lot of different things that we ask for proof for. So, I mean, there can be things like, proof of your age, proof of your citizenship, proof of your marriage, things like that, which are sort of basic, but can make or break a claim for Social Security or SSI. And for those things, we should tell you specifically what documents can satisfy that. And we do need original documents for those kinds of things. So an original birth certificate, not a photocopy, an original certificate of naturalization or marriage certificate, which is challenging right now since our offices are closed because of COVID-19 to safely get those kind of documents from people. But that does tend to be a stumbling block for people. So, one thing that I run into is we're required by law to give you more time to get documents that you need if you're trying to get them, but you have to let us know that that's the case in order for that to happen. So a lot of times I talk to people who say, oh, well, I didn't think that I was going to be able to get this, and so I just didn't pursue I'm sorry about that. I just didn't pursue the claim because I knew it was impossible to get, or it was going to take months to get my marriage certificate from the Philippines or whatever the case may be. So again, this is where self-advocating comes in, because there are laws that govern us, and they say that if you're trying to get something and you tell us that, we have to give you an extension. So, you know, read our letters, talk to your representatives, and understand what you need, and then let us know if you're having trouble getting it, and we can even assist in some cases with that. In terms of medical documentation for disability claims for both Social Security and SSI, you know, what we tell people is we don't require you to provide proof of that, because we are supposed to go directly, or Disability Termination Services is supposed to go directly to your providers to get your medical records. That's part of our process. We ask, unlike some state disability programs and things like that, we ask you to sign a release, and then it's up to the medical examiner to go directly to your providers and request your medical records. Having said that, we can accept proofs directly from you. And for medical documents, that can come in all different kinds of forms. I mean, we can accept copies of medical records. We can forward, you know, electronic CDs full of medical records to our disability determination services. So, you know, that can vary on a case-to-case basis. Sometimes there's really no need for someone to go out and get their own medical records. If you have a provider that's a large provider like Kaiser, and your condition is fairly clear-cut, we often will get your records very quickly and be able to make a correct decision for you very quickly. In other cases, though, either if you don't have a lot of medical records because you haven't been able to get the medical treatment because you don't have insurance, or you know, you've had treatment outside the United States, you've you know, been to smaller clinics or practitioners that, you know, we don't have a solid of a vendor relationship with, who may not be able to get us your records as quickly. That's a case where it would be to your advantage to try and get them, or have your representative try and get them and forward them to us directly, because not only will that allow us to make a decision that's more correct and more timely for you, but it you know, it draws attention to the matters at hand. So not only if you don't have a lot of medical records, sometimes if you have too many medical records, that can negatively impact your claim, unfortunately, because they have to sift through that and try to match something to the specific conditions that are outlined in our policies for awarding disability for various conditions. So, you know, this is, that's one of those things where it can differ from case to case, but in some cases, it may be to your advantage to submit things to us that very specifically demonstrate what is relevant to your claim. And so, although it's I understand it can be very difficult to even to get your own medical records from providers sometimes. But
before I turn to Amy, I'd like, Erin, yeah, absolutely. Just one moment, that I just want to really focus on something Ryan said that I think could be missed. Probably not by our audience, they're a savvy bunch, but I just want to focus on this. If you're making an application for Social Security, and there's a medical examiner in Social Security who will seek medical records, they don't even need to ask you, then it is incumbent upon the individual who's seeking Social Security to make sure that when they're working with a medical team, that medical team is recording everything that would be a part of seeking those benefits. What I mean is, I can think of many examples already off the top of my head of families where someone may go to their doctor and they stay upbeat. They keep a positive spin on things. They say, "Doc, no, I'm doing great, Doc." And they want their doctor to think they're doing well. They want their doctor to feel like, you know, they're doing all the right things. And that mentality ends up contributing to medical records that do not suggest the person is feeling debilitated daytime sleepiness and fatigue, that individual is suffering from constant insomnia. There's any number of issues, complaints, or symptoms I could list in the myotonic dystrophy community that would apply here, right? Where you don't mention it to your doctor or your medical team because you think you want to paint this rosier picture, or you want to be kind, or you have some idea of what you want to present to your doctor. And the result is that that symptom or issue does not get recorded. And this later becomes an issue if you are seeking to file for some kind of a disability or other kind of program, because there's no medical documentation. No matter, even if you've been experiencing things for maybe years, but you've never told your medical team what's been going on. And so there's no documentation. So I really just wanted to highlight what Ryan was saying. I think it's very important. And Erin Springer, I'd like to, I stepped on you a little bit there. I'd like to turn it back over to you, Erin.
No, I think exactly what you just said is probably the most important thing out of maybe this whole entire talk, is that if you don't tell us about it, tell us about it, we don't know about it. And so I think you're right that there's a lot of time, there's this tendency, especially for myotonic clinic providers, that we see you once a year maybe, and you come in and you say everything's fine. And then, there's nothing that we can do unless you come in for another visit if we don't write it down. And so if you just say, I'm fine, things are fine, everything's fine, that isn't going to help in the long run if you are actually experiencing problems. Our goal is to help fix things as much as we can to be able to help you live a better life. We know that we're not going to get rid of this disease, but what we can do is help to make recommendations or adjustments on things to help you feel as good as possible to be able to get back to life instead of worrying about the disease. So I saw all of you guys' heads nodding the entire time and was doing the same myself. Please talk to us about things, even if it means a phone call in between appointments. We want to know about those things because that's what we're here to do.
Erin, thank you so much for that. Amy or Erin B., did either one of you want to add to that issue of documentation and proof?
Yeah, I just want to stress it is so important. I was shaking my head because I know helping individuals applying for disability in the past as an authorized representative in a time, when I was doing that kind of work, you had to actually, Ryan, get the medical records from the doctor. So if you were acting on behalf, you had to get, now everything's available electronically, but I mean, then you had to, you're talking about stacks of documentation that, you have to go through. But so I can't stress enough, and not only documenting, but don't be afraid to ask to review your medical records. If you don't have access to online, or you don't, you're not computer savvy, ask, maybe you're not filing for disability, but let me see my medical records. What are they saying? Also, I encourage you to keep a medical diary for yourself. When you're applying for disability, they ask you a lot of things about your daily living. Can you dress yourself? Can you brush your own teeth? How hard is it for you to go to the store? So when you keep a medical diary and you have that information, maybe if you're doing that in a couple of years from now, your health has declined and you're ready to file for disability, all of that information can be pulled in to prove your case. So documentation is so important. It's the same with utilizing health insurance, because it's that documentation is so important in determining whether you need a medication or a procedure, and you have to be your own advocate. So.
Yeah, and I'll just follow up and say the same thing. So there was a lot of conversation about secondary health conditions or other issues that you might be facing. So it is imperative that when you're doing an application for that, that you include all providers, whether or not that you think it has significant relevance or not, because a combination of health conditions and support could actually be helpful in a disability determination outside just the one main one that you might be thinking. In addition, awareness to your provider's office that there's going to be a request coming, because if you can just think about how much mail and faxes and requests that they get, sometimes there's a clerical error, there's a missing request. And so these things can help really close those long wait periods or timing that they have. And then your doctor's also aware of what you're applying for, and then they can talk to you about, do they think that they can support you in this? And then they, the attentiveness to all of your charting and things. So by being very comprehensive at the beginning and speaking to your the reviewer, as well as your providers and nurses and anyone who's engaged, can actually make the decision more favorable in the very beginning versus you having to go through the appeal process, which can be some time just simply based on those whatever's transitioning. And if you get to an administrative law judge, there may be a pretty significant wait period before you actually can get in to be seen by someone. So that's where that relevance comes in. And if you have any change, any new provider, you need to communicate that to Social Security as well.
Erin, thank you so much. We have so many questions from our audience. I would like to direct this next one first to Ryan to see if he has some insights into this. But we have some coverage questions regarding individuals who are on Medicare and their options for vision and dental coverage and what those recipients should look for. In addition to that, we also had some questions about hearing aids and whether there's anything folks should know about or consider, especially for that coverage. And I don't know if, Ryan, if you could go first on that and if you have some thoughts.
Sure. It's difficult. I get those kind of questions a lot. And it's difficult for me to answer those questions accurately or specifically, I guess, because as I said, Social Security, although we handle enrollments and premium collections for Medicare, because although we do intersect with Medicare and Medicaid, we don't administer the coverage. And so I'm not necessarily an expert on, specific services and devices that are covered. What I will say is that, original Medicare A and B does not cover any of those things. It doesn't cover vision, it doesn't cover dental, it doesn't cover prescription drugs. And so a lot of that hinges on what the supplemental coverage you get is. Advantage plans can include those additional services. And so, it's important to shop around a little bit to pick out supplemental coverage to your Medicare. And sometimes Medicaid can cover some of those things as well, although that is a little thornier. My understanding is that, when times are lean, they do not. So what I would say is, it's something that really, when you are enrolling in your insurance, whether that's through the ACA or a supplemental plan for Medicare, it's important to know, although none of us know what the future holds, but if you need something specific, you need to look for the coverage that covers that, and you need to put the time in or have someone help you put the time in to pick something out that does cover those things, because retroactively it's not going to work. So,
Ryan, thank you. Amy, I think your presentation addressed this a little bit, and I wonder if you could speak to that coverage piece.
Yes, definitely. Well, with Medicare, of course, original Medicare doesn't cover those things. Medicare beneficiaries have an option of adding a Medicare supplement, which still doesn't cover those things. But because Medicare supplement works with Medicare A and B, but there are Medicare Advantage plans, which is the Part C I mentioned, and those Medicare Advantage plans, that's one of the attractive features for people to get a Medicare Advantage. They are managed care, so that's one of the unattractive things. But one of the attractive things is that most of those plans offer dental and vision benefits. So, and you can even, they even have options for you to add even more coverage to the basic benefits. So that's definitely an option for individuals on Medicare to get the dental and vision coverage. They don't find those plans. It's common that individuals find getting the supplement more appealing because they don't have to deal with the managed care. Supplements pick up the 20% original Medicare leaves behind. So there are just some pros and cons that you have to weigh, but for people that really need that dental and vision coverage, it may save you to get the Advantage plan. So you have to sit down and weigh all of those options. It's a lot of information to consider.
Thank you, Amy. Erin, I wonder if you had some thoughts on the vision and dental, but also the hearing aids issue for Medicare recipients or for other individuals as well.
So as shared, so Medicare has that limitation. And so it's important, if that's the only option of insurance that you have, that you do talk to those that you might be seeking those services from. They might give you a self-pay discount. There might be some charitable resources to tap into you do have the right to purchase private dental and vision and those types of things. And keep in mind that they're not protected under those pre-existing clauses. So oftentimes there's a period of time where they do not cover those things, and you have to weigh the pros and cons of that as well. Medicaid can be a supplemental opportunity, or someone who has that coverage, and depending on the state and the age and all of those elements, because I wish I could tell you that there was a clear-cut answer for those, but they're very, very variable. Those might be some opportunities too, but overall, those types of services have been very challenging no matter what insurance that you carry and how much they cover or don't, and might even have a limit on how much they would cover from a commercial plan. A private plan might not match to what your needs are. So I think you just need to kind of have those conversations and understand and recognize what you possibly can uncover. And there might be refurbished or some organizations that offer some of those discounts too. So.
Erin, thank you so much. I'd like to direct the next question to Erin Springer first, to give us sort of the clinical perspective, what this looks like in clinic. The question is about the role of a parent of an adult child with myotonic dystrophy. What is the role in advocating and helping an adult child for that parent? And what resources might that parent be able to get to help them advocate for their adult child?
Yeah, this is a tough one, especially across the myotonic dystrophy community, because there is such a varied impact of the disease on people across the spectrum. And so we definitely have patients whose parents are their main advocates, whether that be children or teenagers, people in their 20s, or even people who are still living in their 50s, 60s. They have elderly parents still kind of watching over them and helping. Couple things that I think are imperative is, in order for you to become an advocate for that person, you really need to have the power of attorney for their decision-making capabilities. If you feel like they are not able to make decisions, medical decisions for themselves, it's important to talk with your medical team about that, so that you can establish that, they're not able to make those, and that you can become that medical decision maker for them. For people who have adult onset and maybe limited with the ability to get to the bank, to get to different things like that, there are different resources that are out there for people to tap into, as far as becoming an advocate for that person. So you can sign checks, so you can do lots of other things for them. I think that it's a hard position to be in sometimes as a parent, to be having to be an advocate, not only for your own healthcare, but also for your child's, especially if that child is an adult. And so making sure you're in touch with your medical team, that social workers or other people that you can be connected with, whether in case managers, especially, I think are important people to be in contact with. There are quite a few people that end up on Medicaid, and with that, that patient is assigned a case manager. And they should really play an important role in, advocating for the patient. And so having those connections as a parent is really important, to be able to not only legally, but also just emotionally, psychologically, and things like that. Having support is an important thing.
Amy or Erin B., I wonder if either of you have some thoughts on adults advocating for their adult children.
The biggest thing is just ensuring that are HIPAA practices, that you have established that you're the representative for this individual. and what that, power of attorney or what that looks like, or just making sure that you get on all of the providers list as an authorized person, because that will help avoid obstacles if you're the main driver behind the medical care for an adult child. It's just making sure you're listed and that they can release information to you.
And that also applies towards all of the topics we talked about today: health insurance, disability. You're not going to be able to call on behalf of that adult child if you do not have that power of attorney or authorized representative. And it's very restrictive. They're not able to talk to you. And think about those children too that might be in that 18 to 26 that we talked about. You have that eligibility to maintain on your parents' plan. I can speak from experience. I have an adult child who doesn't really need my support, but I'm paying the bills, and there's certain things that I need to get access to, and I can't unless he signs me over. And so, those are just really important key factors in order to be able to jump in there and provide that support. So we just recommend you get those things and talk to your child about the importance, or get the medical evidence to get it because they're not able to.
As a final question today, I'd like to throw out a sort of nettlesome, sticky kind of a case study for all of you. I won't be able to get into all of the specifics of this situation, but I'd like to share it to see what your advice would be, each of you. And I will probably start with Ryan on this one. The question regards a young person with myotonic dystrophy. I believe they mean a young adult, so someone who is not a minor, but an adult with myotonic dystrophy, and who's had symptoms for many years, who in fact relies on mobility devices, I think a wheelchair or even leg braces in some cases. But this person is our young adult, and they have applied for Social Security disability several times. They've applied for some form of assistance and been denied several times, despite the fact that they have had a lot of documentation from several different doctors recording their health for many years. And they have even used a lawyer in at least one case, and they continue to face denials. I wonder if you can, with that information, with that context, and no more information than that, give us some tips for what to do in a situation like that.
Sure. And that's hard. I definitely talk to people almost every day who've been denied benefits who seemingly would qualify for them. And because, again, it's the state disability discrimination services who are making those decisions, I'm not always able to understand or explain why those decisions are made. But there are a few things I would say. First of all, it's important to understand why you're being denied for benefits. A lot of folks feel when they get denied for benefits like they're being told that they don't have a condition, that they're not disabled. But keep in mind, both Social Security and SSI have other factors of entitlement other than the medical condition. So for example, with Social Security, if you're working and earning over a certain level, regardless of what your medical situation is, you're not eligible for Social Security disability benefits. And a lot of times folks are denied because of their work, where they're lucky enough to have a job, even with the things that we can exclude, their earnings are over a certain level, but unfortunately that makes them ineligible for the benefits according to the law. SSI is a low income, low resource program. So sometimes with people under 18 who live with their parents, their income resources are deemed to the child. And so again, regardless of the medical situation, regardless of the medical documentation, it's the other factors of entitlement to that program that are causing the denial. And sometimes people don't understand that, and it can be quite upsetting to feel like you're being told that you're faking it, you don't have this condition, but understand that's not always the case. So that's the first thing, and understand why your application was denied. And if it's not clear from the letter you receive, talk to someone, ask for more information. You have the right to have access to the medical records that were used to make your decision. And someone should be able to tell you exactly why the application was denied. The other thing I would say is pursue your appeal rights. Every decision, every formal decision that the Social Security Administration makes has appeal rights. There's generally a 60-day window to file an appeal if you're denied benefits or if we make an unfavorable decision. And even if you miss that window, we can give you more time with good cause. So if you explain to us why you weren't able to file an appeal within that 60-day time frame, we should be able to allow you to pursue the appeal. And good cause can be, I needed help, I didn't understand this, the person who helped my caregiver wasn't there when I got the letter. I didn't have a lawyer when I started this process and I do now. Those things are all grounds for good cause for late filing of an appeal. So I don't know in this case if when the person was denied 3 times, if they went up the appeal ladder or if they just kept filing new applications. But I will say that I see all the time, almost every day, people who have been denied at the initial level of their application and who were approved for benefits on appeal of the medical decision. And that goes, there's multiple levels. You can file first what's called the request for reconsideration, where someone who didn't make the initial decision is going to look at the information and any new information you provide and make a new decision. And if that's denied, you have the right to see an administrative law judge. And then there are levels above that. There's an appeals council, and then you can file a lawsuit in federal court if you continue to get denied. And it can be painful to go through the appeals process because it does take a while. But I would say do that. You have the right, pursue the appeal, because when you file a new claim down the road, rather than pursuing the appeal as soon as you're denied, based on timeframes that are involved, based on how old the evidence is, you may lose your eligibility based on the later filing date. So definitely pursue the appeal as soon as you get that decision that you think is wrong. And the last thing I would say is it's great to use a lawyer if you're able to do that. It's great to use an authorized or appointed representative to help you with your claim, but not all representatives are created equal. And I don't want to cast any dispersions on any particular group of people or any particular representative, but just like any profession, there are people out there who are more concerned with their paycheck than they are with you. And there are people out there who really care about you and are going to do everything in their power to help you. And when you're choosing someone to help you with a Social Security claim, particularly if it's someone who's charging you a fee, which is fine, perfectly fine, you may want to do a little research. You may want to talk to other people in your community and find out who they've had success with and who they haven't had a good experience with, because that can make a big difference. And I can tell you from dealing with attorneys and advocates, some people take a real interest and some people just kind of sit back and send faxes. So that can really impact your claim. So those are the things that I would say to think about in that situation.
Ryan, thank you so much. I'm going to kick it to Amy. In less than 30 seconds, do you have some thoughts on this?
The only thing I would add is just because Social Security looks at everything, they're looking at your education. Do you have any trade skills? So sometimes you have to really dig deep, like, if your degree is, or your trade is in something that's, that you're not really claiming on your disability, they'll say, well, you can still do this type of work. So you really need to pay attention to what's your work history, what's your skill level, what's your educational level, how old are you, what type of jobs can you do? And if you can't do them, then that's important to document. So.
Thank you, Amy. Erin B., 30 seconds or less.
Sure. I'm just going to remind everybody about employer-based benefits. So while we're talking about Social Security, make sure that you understand and know what your benefits are from a disability standpoint as well, because there might be short-term or long-term benefits that you can tap into, and you do not want to miss those opportunities and move out of a work status, because those can be financially supportive, and a lot of long-term disability plans will support you with a Social Security application.
Erin B., thank you so much. Erin Springer, do you have some final thoughts for us on that tricky
kind of
situation?
Ditto what everyone said. I think what Ryan said too is just like with people that are helping to file things, claims are not always created equal. Unfortunately, the medical community is the same way. You may find nurses or physicians or others that just aren't as invested and they don't want to do the work, or they're just incredibly busy and they just don't have the time to put forth. And so making sure you find a provider that you connect with, that you feel you can be honest with, and will actually document what your medical needs are. I think it's important.
Erin Springer, thank you so much. Ryan Frayne, Erin Bradshaw, Amy Jackson, what an extraordinary panel. To our audience, I would simply say that look at all these incredible giant brains. These folks together know more about health insurance than I think anybody alive possibly could. And even they will tell you how complicated these situations can be. That is, can be daunting, but it also is an affirmation. If you find that it's complicated, look to some of these folks for resources. Look to the Patient Services, Inc., look to the Patient Advocate Foundation, find resources online at your local Social Security Administration office or Medicare or Medicaid, and work with your medical team. There's a lot of resources available through the Myotonic Dystrophy Foundation as well. So thank you all so much for joining this session. And now in the next few minutes, we will all go to our community panels. Please find the community panel for you. Thank you all so much. It has been a pleasure.